Hello, my name is Eddie Jimenez. I'm going to talk about tuberous sclerosis complex. Definitions. The tuberous sclerosis complex is a multisystemic autosomal dominant genetic disorder with complete penetrance that can evolve with hamartomas on multiple organs such as skin, central nervous system, kidney, and lungs. Due to the wide phenotypic variability, the disease is often not recognized. Tuberous sclerosis complex affects 1 in 10,000 newborns, and most patients are diagnosed during the first 15 months of life.
I can't remember exactly, but I think I first met Manny when he was just a few years old. He had actually been diagnosed as having tuberous sclerosis even before he was born because his mom knew she had it, and a prenatal ultrasound showed that Manny had cardiac tumors as a fetus. But he didn't come to the CRS clinic until he started having seizures, which was probably around age 1 or 2.
Tuberous sclerosis ranges in symptoms from mild to more severe. The more severe symptoms of tuberous sclerosis are caused by these benign tumors that appear in the patient's brain, heart, and kidney. And when they appear in the brain, they can cause the patient to have severe seizures.
Manuel has seizures called complex partial seizures. And every day he has a struggle because he doesn't understand the illness. So I have to kind of explain to him, what stuff he can and can't do, because there's some limitations with the tuberous sclerosis that leads him to having struggles every day, like academics and, just personal needs.
Patients with TSC can inherit tuberous sclerosis complex from their parents 1/3 of the time. And in the other 2/3, they develop this disorder just on their own, so it's new to them.
I was first diagnosed as a child myself. I had seizures. I had grand mal seizures. I had outgrew my seizures, but Manuel has seizures 2 to 3 times a day, and the neurologist is trying to find more options because they're running out of options on medications.
But I think what we are trying to do, our goal is really to discover a method of blood testing in children as soon as they're born. Not necessarily to make the diagnosis, but really to provide a way of predicting disease severity and also provide a way of, treating the patients. Some of the advantages of the Center for Rare Childhood Disorders, whether it has to do with our research related to tuberous sclerosis or any of the many other conditions we study, we are able to evaluate patients, collect their clinical information, characterize that phenotype, and at the same time enroll them in research protocols.
Applications in medicine. A 71-year-old man presented to the nephrology department for the evaluation of chronic kidney disease, which had developed during the past 20 years. The patient had received a diagnosis of tuberous sclerosis complex, or Burnaby's disease, in his late 20s. The physical examination revealed erythematous papules on the chin, nose, and cheeks consistent with facial angiofibromas and small fleshy periangle fibromas of toenails. For this patient, we recommend a low salt intake, high blood pressure control with 5 mg of amlodipine twice daily, and avoidance of non-steroidal anti-inflammatory drugs. 1 year later, he had stable kidney function and unchanged cutaneous findings.
Let me start first a little bit with the pathophysiology of TSC, and then it kind of relates to what you should be looking for as a clinician. So tuberous sclerosis complex is a genetic disorder, and it's caused by mutations either in the TSC1 or the TSC2 gene. And mutations in this gene lead to overactivation of what we call the mTOR signaling pathway. Now that pathway is important because more recently, or for some time now, we're starting to develop medications that can target that pathway. But overactivation of that pathway leads to loss of control over cell growth and cell division, which is why we see many of the manifestations that patients have with tuberous sclerosis complex, which is development of what we call non-malignant or benign growths, often termed tubers in the brain. But this can occur in the skin, the eyes, the kidneys, the heart, the lungs, the liver. So it's grossly manifested throughout the body. Now, things to look for as a clinician are actually quite evident in tuberous sclerosis complex because it's also known as a neurocutaneous syndrome. So you have neurologic syndromes, but you have cutaneous or skin findings. So often things that you can see secondary to this overactivation and this overgrowth. So things that you can see on these patients are hypomelanotic macules. So these are light patched macules throughout the body. You can also see angiofibromas on the face, over generally in this distribution. You can also see something called a shagreen patch as well. And I really encourage clinicians to look up some of these things because there's a vast amount of information and photos of this to help identify these on individuals with tuberous sclerosis complex. But even what's more important with TSC is because of these growths, we can identify this disorder at a very young age, even in utero. So with
Issue apply inequality. A search of medical records of patients with tuberous sclerosis was carried out between 2012 and 2016 at the Pediatric Hospital of Ecuador. 22.5% of patients had a family history of TSC. 61.3% of patients were diagnosed before 2 years of age. In 74.1% of patients, seizures were the most frequent clinical sign at the time of diagnosis. Of this group, 39.1 have refractory epilepsy.
I can remember when my son was 2 days old and he was diagnosed with tuberous sclerosis complex, and I remember how completely overwhelming that felt for us. We initially, it's not something that a lot of medical personnel necessarily deal with in their careers, and so initially we had a lot of misinformation, and I just remember how frightened and scared we felt and how hopeless we were. And we got on the Tuberous Sclerosis Alliance website and got some reputable information, and we connected with some doctors here at Children's Hospital Boston. And I guess if there's anything that I could say to a new parent who just has an infant that was diagnosed, is that there is hope out there. You read all these horrible things that can go wrong, and yes, some of those things may happen to your child, but they won't all. And so many of those things are further down the road. For the moment, just enjoy your baby and just love on that child. There are so many wonderful things about my son. And yes, he has tuberous sclerosis, and we have dealt with so many challenges.
Next one are the pros and cons. The pros would be that most people with TSC will live a normal lifespan if they are treated correctly. A recent study in the UK examined the medical records of 334 people with TSC over 15 years. That means that they have a good lifespan. Although there is no cure for tuberous sclerosis, treatment can help manage specific symptoms. For example, the ones that we have seen, they have the kidneys infection, lungs infection. The cons will be complications in some organs, such as the kidney, lungs, and brain, can lead to severe difficulties, even death. And uncontrolled epilepsy can also be life-threatening. For the conclusion, we have that the identification of tuberous sclerosis complex gene mutation has fostered an understanding of how brain lesions in TSC are formed. Further characterization of the roles of hermetic tumoring will provide potential therapeutic avenues to treat seizures, mental retardation, and tumor growth in TSC. Thank you.